Colon cancer develops slowly, often without noticeable symptoms in its early stages. However, your body may give subtle signs that shouldn't be ignored. These warning signals can range from changes in bowel habits to unexplained fatigue. Identifying these early symptoms is crucial for timely diagnosis, as catching colon cancer in its initial stages greatly increases the effectiveness of treatment and could save your life. First, unexplained bloating or abdominal pain. Unexplained bloating or abdominal pain can be troubling symptoms that may point to various underlying health issues like colon cancer. Bloating refers to a sensation of fullness or swelling in the abdomen, often due to the accumulation of gas. In many cases, bloating and abdominal pain are harmless and are often linked to digestive issues such as overeating, indigestion, or food intolerance. However, when these symptoms become frequent or unexplained, they may signal more serious conditions like irritable bowel syndrome, IBS, celiac disease, or infections, including colon cancer. Colon cancer may cause bloating and abdominal pain due to the tumor's presence and its interference with normal bowel function. As the tumor grows, it can block parts of the colon, leading to bloating, discomfort, and pain. For those over 50 or individuals with a family history of colon cancer, these symptoms should be taken seriously. Even if the discomfort is mild or temporary, it's important to seek medical advice and tests to identify the root cause. Second, blood in stool. Blood in stool is a symptom that should never be ignored, as it can indicate a range of digestive or gastrointestinal issues, from mild to severe. The presence of blood can vary in appearance depending on where the bleeding occurs in the digestive tract. Bright red blood often signals bleeding in the lower digestive tract, such as from hemorrhoids or anal fissures, while darker or black stools can suggest bleeding in the upper gastrointestinal tract, like from ulcers or a bleeding stomach. Blood in the stool can also be a sign of more serious conditions, such as colon cancer. In colon cancer, tumors may bleed, leading to visible blood in the stool, which may not always be immediately noticeable. If you experience blood in your stool, especially if it's persistent or accompanied by other symptoms like abdominal pain, fatigue, weight loss, or changes in bowel habits, it's important to consult a healthcare provider. Number 3. Mucus in stool. Mucus in stool is a condition where an unusual amount of mucus could be a serious indicator of colon diseases. The presence of mucus can sometimes be linked to gastrointestinal conditions like irritable bowel syndrome, IBS, where inflammation causes the intestines to produce more mucus. It can also be associated with infections, inflammatory bowel diseases, IBD, like Crohn's disease or ulcerative colitis, and even colorectal cancer in some cases. If mucus in the stool is accompanied by other symptoms such as abdominal pain, changes in bowel habits, or blood in the stool, it's essential to seek medical advice. Mucus is a normal substance produced by the intestines and is typically clear or white. It helps lubricate the intestines and facilitates the passage of stool. However, when mucus is found in larger quantities or has a noticeable change in color, it may indicate an underlying issue. Number 4. Fatigue and weakness. Fatigue and weakness are common symptoms that can be caused by a variety of health issues, including colon cancer. Fatigue refers to an ongoing feeling of tiredness or lack of energy that is not relieved by rest or sleep. Weakness, on the other hand, is a physical sensation of reduced strength or difficulty in performing tasks that are usually easy. In the context of colon cancer, fatigue and weakness often result from the body's response to the cancer itself, as well as from blood in stool or mucus in stool, can be a serious indication of disease. When colon cancer causes bleeding in the digestive tract, even small amounts of blood loss can lead to anemia, a deficiency of red blood cells, which is a common cause of fatigue and weakness. These symptoms may be subtle at first, but as the cancer progresses, the fatigue may become more pronounced, and individuals may feel weak or unable to carry out normal daily activities. It is important to recognize these signs, and anyone experiencing prolonged fatigue and weakness should seek medical attention for proper evaluation and diagnosis. Early detection and treatment of any underlying condition can significantly improve the chances of managing or curing the disease. Number 5. Rectal pain or discomfort. Rectal pain or discomfort is a common symptom that can be caused by various conditions, including colon cancer. It refers to any pain or discomfort felt in the lower part of the abdomen or around the anus and rectum. This type of pain can range from mild discomfort to severe pain and may be constant or occur only during bowel movements. In the case of colon cancer, rectal pain may arise when a tumor blocks the normal flow of stool or causes irritation in the rectal area. As the tumor grows, it can press against the surrounding tissues, leading to discomfort, cramping, or pain. In some cases, rectal pain can also be accompanied by other symptoms like blood in the stool or a feeling of incomplete bowel movements. Although rectal pain can also be caused by other, less serious conditions like hemorrhoids, anal fissures, or infections, persistent pain or discomfort should never be ignored. If rectal pain is ongoing or worsens over time, it is important to consult a healthcare provider for a thorough evaluation. Timely detection of rectal pain or discomfort issues, including colon cancer, is very important for better outcomes and more effective treatment options. Number 6. Persistent changes in bowel habits. Persistent changes in bowel habits refer to any lasting alterations in the frequency, consistency, or appearance of stool that last for more than a few weeks. This symptom can indicate a variety of underlying conditions, including colon cancer. Some common changes in bowel habits include diarrhea, constipation, or alternating between the two. In the case of colon cancer, a tumor can partially block the colon or rectum, leading to changes in how often you pass stool or how it appears. Individuals with persistent changes may experience stools that are narrower than usual or feel as if they haven't fully emptied their bowels. These changes can occur gradually and may not be immediately noticeable. It's important to monitor the pattern of these changes and should be consult with a healthcare provider. Number 7. Dark or black stools. Dark or black stools can be a sign of bleeding in the upper gastrointestinal tract, which includes the esophagus, stomach, or the first part of the small intestine. When blood from these areas is digested, it can turn the stool a dark or black color, often resembling tar. This condition, known as melena, can be caused by various issues, such as ulcers, gastric bleeding, or even certain medications like iron supplements or anticoagulants. However, when this symptom is present along with other signs such as unexplained weight loss, fatigue, or changes in bowel habits, it could indicate a more serious condition like colon cancer. Tumors in the colon or rectum can bleed slowly over time, leading to blood in the stool that may appear dark or black. The blood has had time to break down before reaching the stool, which causes the dark coloration. Number 8. Narrow or ribbon-like stools. Narrow or ribbon-like stools are stools that appear thinner than usual and can result from various causes. Commonly, a lack of fiber in the diet can lead to smaller, harder stools, making them thinner. Narrow stools may also occur due to physical obstructions in the colon, such as tumors or polyps, which narrow the passage for stool, causing it to take on a ribbon-like shape. Conditions like inflammatory bowel diseases, IBD, including Crohn's disease or ulcerative colitis, can cause inflammation and narrowing of the intestines, resulting in thinner stools. Individuals who are facing these problems should prompt a medical evaluation. Recognizing the early warning signs of colon cancer is a vital step in safeguarding your health. If you notice any of the symptoms mentioned, don't hesitate to consult a healthcare professional for proper evaluation and testing. Early detection can make a life-saving difference.